Welcome back. Now, around 500,000 people in Ireland have COPD, or chronic obstructive pulmonary disease, making this progressive lung disease the fourth most common cause of death in Ireland after lung cancer, heart disease and stroke.
Tomorrow marks the start of World COPD Week, and with us to tell us her story of living with the disease is Bernie Leonard, as well as Dr. Emer Kelly, consultant respiratory physician at St Vincent's Hospital. Good morning to you both, ladies.
Good
morning.
Thank you for joining us. Bernie, we were just having a chat during the break about your experience. Life was busy, going back to before you contracted this disease. Busy job, busy lady, happy life, non-smoker, felt very fit.
Yes, I was very fit. Loved to walk, loved the Phoenix. I live beside the Phoenix Park, so I walked to the Phoenix Park quite a lot. And just, as you say, I enjoyed life. Mild asthma, you know, nothing to stop me. As I said, I could run for a bus.
Yeah. So something you managed with an inhaler?
Yeah, managed with an inhaler. Professor Shane O'Neill just had diagnosed me with mild asthma and said you can live normally, but then things started to change. I would get infections and they would, you know, be longer and longer in duration. And then you'd have the odd hospital admission, then they were more prevalent, more numerous, more frequent. And then in 1998, they became quite bad and started to cough up a lot of blood and that. And I was out of work for a year. Now, I'd been out of work a good bit up to that.
Okay.
And then from 98 to 99, I was out of work for a solid year. And then in 1999, at the age of 49, I had to retire from Aer Lingus after a little over 31 years.
And at what point, Bernie, during those years, did they come to the diagnosis that it was COPD?
They didn't at that stage.
Right.
They told me it was asthma, and then it was bronchiectasis. And then through numerous admissions in and out of the bonds in Glasnevin, finally, about 4 years ago, Professor Shane O'Neill said to me, you know, you have COPD, Bernie. But I knew things had started to change because I found it very hard to breathe. You know, you would have... it was very hard to breathe at night. It was very hard to bend down. The steroids weren't really acting as well as they should have done. Massive doses of steroids. And then they brought their problems, you know, dreadful muscle difficulties. I would fall. Then I got a clot in the lung. So, like, there was huge difficulties starting to come. I started to become quite immobile. So what I was, you know, you were given COPD as a diagnosis and you're told you can't do ABC. And I was really housebound for quite a long time. My leg was in a boot, and I couldn't get out, you know.
That
and it was
changed
it was huge change, you know.
Well, from someone who'd been so active
Yeah,
and had been working
like I'd walked the Dublin City Marathon.
Yeah.
You know, and I haunted the Phoenix Park.
Emer, will you tell us exactly what COPD is? Because I hadn't heard of it.
No, I'd never heard of it
either.
And it is a term, maybe a lot of people are more familiar with using the term emphysema or chronic bronchitis.
Right.
So, but now we use the umbrella term COPD. And it's a condition that, for the most part, affects people who've been smokers or current smokers. And it tends to onset after the age of 40. And people would get, as Bernie described, shortness of breath, wheeze and some chest infections. And I suppose it's so common, yet, as you said, lots of people haven't heard of it. And what we're really focusing on is just getting it out there. And the campaign this year from COPD Support Ireland is Let's Talk COPD, because we need to mention it. And I treat a lot of different lung conditions, but COPD is a little different because when patients are often slower to come to us, and that there's sometimes, because they've been smokers, that they blame themselves to some extent for their symptoms. But then when they start to feel better with the treatments or with the exercise programs, that they're actually surprised sometimes. But there's very good treatment there, and we just want people to know that getting diagnosed earlier does make a difference to them.
Is it rare for a non-smoker to develop it, or is it?
About 10% of people with COPD haven't been smokers.
Right.
So that means 90% have. But
which
Bernie's
was you.
story is very clear that it can happen in people who've never been a smoker in their whole life.
It can, yeah, I never smoked, as I said, and it can be you can get COPD from viral infections, from untreated pneumonia or pleurisy or things like that. So it can happen in 10% of us that we can get it that way. And as I said, I was like 48, my life turned upside down. 52, you definitely have it. But what we're trying to say today is, you know, there's so many people out there who have it. They don't know they have it.
They don't realise.
Yeah.
And if one person comes forward this week, it's a victory. And because you have it, you're told when you're diagnosed, you have it, and you know, you're restricted in and you can't do ABC. But the point is, actually, you're not as restricted as you're led to believe. CL Blue is a wonderful group, and they provide exercise therapies for us. And in Whitehall, the group, COPD group I'm involved in, we had a wonderful guy. We have a wonderful guy there, Paul Kerwin, and I went along to the group there. We got the group started there. There's lots of groups in the country, and they're wonderful. But we got the group started there, and the first thing he said to me when I walked in was, "Well, you have COPD. I believe you think you can't exercise. Well, I'm going to tell you, you can." And he only killed us.
Yeah.
He absolutely killed us with the
Emer, can I
exercise.
ask you, just from a medical point of view, what's happening to the body if you have COPD?
So it's a process that happens over years, that the airways change slightly. It starts with some inflammation, and then the airways maybe become a little bit narrowed. And a lot of our treatments focus on opening up those airways, so to get the breath in and being able to breathe out. And breathing out is a major part of how we tolerate our exercise. And as Bernie said, it's quite an isolating condition, because if you feel you're short of breath, you don't want to get out there and exercise, but counterintuitively, it's the most positive thing you can do is exercise. And we have bespoke exercise programs with pulmonary rehab at a hospital level, but then that feed into great exercise programs like the one Bernie attends in Whitehall. And it makes such a difference to people. It's a really positive part of healthcare, I have to say, to be involved
And in terms of the treatment, Emer, is it, as Bernie was describing earlier, is it steroids, or it depends on the level of the COPD, does it?
So it depends on the level. You're absolutely right, Simon, and that there's steroids in some of the inhalers we use, and then when people get sick, so this time of year with different viral infections, when things get a little low for people, they probably need tablet steroids, but just for a short period of time. And then we try and get people back to their good baseline level, get them back exercising and get them back well again.
It's so interesting that, as you say, Bernie, that if one person comes forward this week, it's a victory. Because when you're describing the symptoms, I'm asthmatic.
Yes.
And you're describing the symptoms there and the narrowing of the airways. That's, I would,
how
even
that
if I get a
feels.
chest infection, I would say, gosh, I'll just take another puff of the inhaler. That's the asthma.
Yeah.
You know, but you need to look beyond that.
Yes.
And particularly at a certain age, you need to look beyond that, because you say it's past 40 where it becomes more prevalent. So is it a case of going to your doctor and saying, look, I need to be tested for this? Or?
And it's a simple breathing test, and even at some of the events this week on World COPD Day, that there will be places in the country where that's available to people, that they can go and get the test done, even in the event in Wynn's Hotel that Bernie's going to be at. But it's a simple breathing test, and it just enables you to go on and then get the right treatment and get a really personalised, individualised plan for what can make you feel better every day.
Well, the website has been on screen, and you're
great.
hugely positive about it, Bernie, aren't you?
Yeah, absolutely. And I would say to people, you know, if you feel you can't walk, start with 5 minutes a day. The next day, add a minute, and the next day, add a minute, and eventually look at your calendar. You've hit 12 minutes.
Yeah.
Okay, you can't go out in the cold, in the very, very cold, or if it's wet. But
it's baby steps
it's
to
baby
build it up.
steps.
Yeah.
And this week in Wynn's Hotel on Wednesday, on World COPD Day, there's lots of events. You can have a free lung test, and that's the most important thing. There will be talks on nutrition, there will be talks on exercise, and lots of other little events there. I would urge people, please come along.
Just drop along.
Just drop along in. It's free. There's tea, there's coffee. There's CL Blue will have a stand there. All our other stands from COPD will be there. Pharmacists will be there. Find out if you're taking your inhaler right. Something so simple.
We all know someone with this condition, even if they don't know it.
Yeah.
Ladies, thank you for coming in this morning.
you very much.
Thanks for having us.
Thanks for having us.
Right, we're back with more Sunday AM after the break. See you in a few minutes.